So you just received chemotherapy or cancer-directed therapy and you are feeling nauseous. Why? Well, there is a gut-brain connection that causes nausea, and also many of these drugs are considered highly emetogenic or moderately emetogenic, which means they have a high association of causing nausea and vomiting. And up to 70% of people report nausea with chemotherapy and or cancer-directed therapy. So you're not alone. So what can we do to combat this nausea? Well, there are several medications that you can get either prior to the cancer-directed therapy, dripped in the IV or given orally. There's also prescriptions you can take home. And again, it all depends on the regimen you're getting, whether it's moderately emetogenic or highly emetogenic drugs. So nausea is classified as anticipatory, acute, and delayed. So what does that mean? Anticipatory nausea is when you start to associate your treatment with a smell, a color, a place, and you get nauseous before you've even been given the medication. And this can be treated with Ativan, which is a benzodiazepine, Xanax, which is also a benzodiazepine, or you can try meditation, hypnosis, and breathing exercises. Acute nausea is associated with chemotherapy about starting immediately after it's given to a few days later. And ways that we can treat this are having prescriptions at home, like Compazine. It's a 10 milligram tablet. The other name is prochlorperazine. You take one tablet every 6 hours as needed. Zofran or ondansetron is another medication that is helpful to treat nausea. And it comes in an oral dissolving tablet where you can just pop it under your tongue and it works pretty quickly, or you can ask for the regular pill that you swallow and within 30 minutes you should be feeling relief. And this can be given once every 8 hours. Additionally, we use steroids like dexamethasone, 4 milligram tablets. Oftentimes we do 4 milligrams twice a day for the 3 days post chemo. This can really help offset nausea side effects. And then another drug that's come on the market that we use quite a bit, well, it's been on the market, it's an antipsychotic drug called olanzapine or Zyprexa, 2.5 to 5 milligrams. Taking this at night for the first few nights post chemo is known to help in highly emetogenic regimens. And the reason we prescribe this at night is because it can cause fatigue and dizziness, but it seems to work really well. Also, Ativan, which is a benzodiazepine, has been known to help with acute nausea. And 1 milligram every 4 to 6 hours is also very helpful. And then if you're suffering from delayed nausea, which is several days later, you want to make sure you're getting an IV medication like an NK1 antagonist known as Emend or Prepitant or Cinvanti. It's a 30-minute infusion that's given before your cancer-directed therapy. So these are some great drugs that you may want to ask your provider about. If you're looking for something more natural, acupuncture is a fantastic way to help treat nausea. I would go visit your acupuncturist 24 to 48 hours after your infusion, and they can work on your symptoms with different needle points. Also, ginger, it's a fantastic supplement, can be brewed in a tea or taken in a capsule. This is known to help with nausea. Acupressure is also helpful. Sometimes hypnosis and meditation can also help with the nausea. And furthermore, you want to make sure that you're staying well hydrated because when you get dehydrated, this can significantly worsen nausea. So my biggest recommendation is getting electrolytes and water because oftentimes plain water starts to taste like metal or cardboard. My favorite is Element, LMNT. These are sticks you can buy on Amazon from their website, from Thrive Market. Add a packet to water and it flavors it, and you're getting potassium, sodium, and magnesium. You can also go to Whole Foods and there's things like Noon or Ultima. I really don't love Gatorade or Pedialyte. These are full of sugar and have other additives. And then also making sure that you're eating protein and a healthy fat. That can often settle the stomach. And it doesn't have to be fancy. I'm not asking you to go eat a big steak dinner. Things like scrambled eggs, smoothies, Greek yogurt, cottage cheese. Those are good things to start with when your stomach is just feeling unsettled. You should follow along with Functional Cancer Care for more tips and tricks.